Okay, picture this. You glance over at your dog, and something just doesn't look quite right with their eye. It's red, maybe even a little cloudy, and they seem to be squinting. Definitely more bothered than usual.
Yeah.
Today, we're taking a deep dive into what could be going on, a condition called anterior uveitis in dogs.
Exactly. And at its heart, anterior uveitis is basically inflammation affecting the front parts of the eye. So we're talking the iris, which gives the eye its color, and also the ciliary body, which is, responsible for making the fluid inside the eye.
Oh, okay.
And it's important to know that sometimes this inflammation can also involve the back of the eye, too.
So it's definitely not just like a superficial redness then.
No, not at all.
For you listening, our goal today is to really get a handle on this, well, relatively common issue in our canine companions. We're going to break down what signs to look for, what might be causing it, and what it really means for your dog's well-being. All without getting too bogged down in complicated medical speak. We're pulling all this info from a comprehensive veterinary text.
And what's really fascinating, I think, is to consider the delicate balance inside the eye that gets disrupted in uveitis. You can sort of imagine the inside of the eye has this, well, like a security system almost. It's a barrier called the blood aqueous barrier. And this barrier normally keeps things really tightly controlled, what gets into the eye's fluid. But in uveitis, the system, it gets compromised.
Okay, let's unpack this. So when this security system is weakened, things that shouldn't be there start leaking into the fluid right there at the front of the eye.
Precisely. Things like proteins from the blood, even blood cells themselves, they can find their way in. And this isn't just random. It's triggered by a whole cascade, a chain reaction involving various chemical messengers, things like histamine, prostaglandins.
Ah, the inflammation chemicals.
Yeah, exactly. Think of them as the alarm bells and the first responders in this inflammatory event happening right inside the eye.
So it's like a domino effect of inflammation. Now, while this is happening in the eye, is it always just a problem isolated to the eye itself?
That brings up a really, really important point. While anterior uveitis obviously shows up primarily in the eye, it can often be, well, a red flag. It could be signaling an underlying health issue that's actually affecting the entire body. Sometimes the eye is just the first place where these bigger problems become visible,
That's crucial to understand. It's not necessarily just some local eye irritation. Now, how common is this really? Is it something that should be on every dog owner's radar?
It's definitely considered a fairly common condition in dogs, but getting an exact number, a true prevalence, that's tricky. Think of it like this. Lots of dogs with uveitis will see a vet, sure, but maybe not every single case gets recorded in a central database, that kind of thing.
Interesting. And I'd imagine where you and your dog live could also play a role, couldn't it?
Oh, absolutely. Your geographic location can definitely influence the odds of certain infectious agents being the cause.
Like fungus or ticks or something.
Yeah. Exactly. If you live in an area where a specific type of fungal infection is common in the environment, say, the likelihood of that fungus being the underlying cause of the eye inflammation goes up.
That makes total sense. Certain tick-borne diseases being more prevalent in specific regions. Now, are some dog breeds just sort of more prone to developing this condition than others?
Yes, we definitely see breed predispositions. Golden retrievers, for instance, they have a higher tendency to develop uveitis linked to these tiny cysts on the iris and ciliary body. Sometimes it's called pigmentary uveitis or, golden retriever uveitis.
Okay.
It really seems there might be some genetic component in these breeds that makes them more susceptible.
Okay, so golden retrievers and these cysts. It's one thing to be aware of. Are there any other breeds that particularly stand out?
Yes. Siberian Huskies, Akitas, Samoyeds, and Shetland sheepdogs. They have a higher incidence of a condition known as uveidermatologic syndrome.
Uveidermatologic. So eyes and skin.
Exactly. As the name suggests, it affects both the eyes and the skin. It's thought to be an autoimmune condition, basically where the body mistakenly attacks its own pigment-producing cells in both the eyes and the skin.
Wow. So in those breeds, it's a much more widespread issue then.
It can be, yes.
And what about age? Is anterior uveitis more of an older dog thing, or can it just pop up at any stage of a dog's life?
It really can affect dogs of any age. But it's interesting that uveidermatologic syndrome we just mentioned, that tends to show up in younger dogs. The average age is around 2.8 years at diagnosis.
Oh, quite young.
Yeah. But then golden retriever uveitis, on the other hand, that tends to affect older dogs with an average age closer to, say, 8.6 years.
Oh.
So this difference in age ranges can sometimes give us clues about what the potential underlying cause might be.
That's a really helpful overview of the basics. Now let's get down to what a dog owner might actually notice if their dog has anterior uveitis. What are the key things they should be looking for at home?
Right. So the signs an owner might first spot often include exactly what we kind of touched on at the start, a red eye. That's caused by inflammation of the conjunctiva, the
Mm.
clear tissue covering the white part, and also those deeper blood vessels getting inflamed.
Okay, redness.
They might also see a distinct cloudiness in the eye. This could be due to swelling of the cornea, that clear front surface, or it could be from the actual presence of protein and cells floating around in the fluid inside the front of the eye.
Red and cloudy, those are definitely things most owners would pick up on. What other signs of discomfort might they see?
A painful eye is another very common sign. This can show up as excessive squinting. The technical term is blepharospasm.
Blepharospasm, okay.
Think of it as the dog's way of trying to protect a sore eye. They might also be really sensitive to light, which we call photophobia.
Right, hiding from bright light.
Exactly. And you might see them rubbing at their eye more than usual. And depending on how severe the inflammation is and how long it's been going on, they might also experience some degree of vision loss.
Okay, so those are the things we might see at home. What does a veterinarian look for during an exam that specifically points towards anterior uveitis? Maybe things an owner wouldn't spot.
Yeah, so during an eye exam, a vet is looking for several specific things beyond just those general signs of discomfort. They'll check for any discharge from the eye. It's usually watery, kind of serious, but sometimes
Absolutely.
it can be thicker, more mucoid, or even pus-like.
Okay.
We'll also carefully examine the conjunctiva for that redness, both on the surface of the eyeball itself and on the inside of the eyelids.
And that cloudiness we talked about,
Yeah.
how does a vet assess that more precisely?
Well, a vet will look for corneal edema. That's the swelling of the cornea, which can range from just a mild haze to really significant opacity, making it hard to see into the eye.
Right.
They'll also look for something called chorotic precipitates, KPs for short. These are tiny little clumps of inflammatory cells that can actually stick to the inner surface of the cornea. You often see them more towards the bottom part of the eye.
Chorotic precipitates, like little specks inside?
Kind of, yeah. Like dust settling on a window pane, but inside the eye. It's a definite sign of inflammation within the eye.
Got it. What else are they examining closely in there?
We also look for something called aqueous flare in cells. This is where that cloudiness in the fluid at the front of the eye becomes really obvious when we shine a very narrow, bright beam of light through it in a darkened room.
Oh,
It literally looks like you can see tiny particles like dust motes floating in that beam of light. That's the protein and cells that have leaked in.
okay. I can picture that. What other specific signs are vets checking for?
We look for something called ciliary flush, which is this ring of deep redness right around the edge of the cornea again, a sign of inflammation inside the eye, not just on the surface. We'll also check for deep corneal vascularization. That's new blood vessels growing into the cornea from the edge, trying to respond to the inflammation.
Right.
The pupil size and how it reacts to light are also really important. Often with uveitis, the pupil will be smaller than normal. It's called miosis. And it might be sluggish or resistant to dilating, even in the dark.
Meiosis, smaller pupil.
Right. Sometimes the iris itself, the colored part, can look a bit thickened or swollen. And surprisingly, perhaps, in many cases of uveitis, the pressure inside the eye, the intraocular pressure, or IOP, is actually lower than normal.
Lower pressure.
Yeah.
That seems odd with inflammation.
Yeah.
You'd think swelling would increase pressure.
It does seem counterintuitive, right? But what happens is the ciliary body, which normally produces the fluid that maintains the eye pressure, gets inflamed, and its function can be temporarily reduced, like a factory slowing down production because of a disruption.
Ah, okay. That makes sense.
We also look carefully for posterior synechia. That's where the back surface of the iris can actually stick to the front surface of the lens, which sits right behind it.
Sticky iris.
Yeah, not good. And sometimes we might even see fibrin, which is like a component of blood clots forming strands or clumps in the anterior chamber, or even, in more severe cases, hypopyon, which is visible pus, or hyphema, which is blood, settling at the bottom of the front part of the eye.
Wow. Okay, that's a really comprehensive list of things a vet will be looking for. Are there any changes that can happen over the long term if the uveitis isn't resolved or becomes chronic?
Unfortunately, yes. If anterior uveitis persists or keeps recurring, it can lead to several serious complications.
Like what?
These can include rubeosis iridis, that's the growth of abnormal new blood vessels on the surface of the iris. Also, iridal hyperpigmentation, where the iris just becomes darker in color over time.
Hmm.
You can also see the development of a secondary cataract, where the lens becomes cloudy because of the chronic inflammation. Lens luxation is another risk, where the lens actually shifts out of its normal position. Then there's pupillary seclusion and iris bomb. That's where those adhesions, the synechii, become so extensive that fluid gets trapped behind the iris, causing it to bulge forward. And a very common and serious complication is secondary glaucoma, where the inflammation eventually damages the eye's drainage system, causing the pressure inside the eye to become dangerously high.
So the pressure can start low, but end up high if it goes on too long.
Exactly. It's a major concern. And in the most severe, long-standing cases, the eye can essentially give up and start to shrink, becoming non-functional. That's called phthisis bulbi.
Goodness, that really highlights how important it is to get this diagnosed and treated promptly. So let's delve into the why. What are the actual underlying causes of anterior uveitis in dogs? It sounds like there could be quite a few.
You're absolutely right. The list of potential causes is pretty extensive, which is exactly why a thorough investigation by the vet is so important. We generally group these causes into categories like infectious causes, immune-mediated ones, things related to tumors, metabolic issues, and then a sort of miscellaneous group.
Okay, let's start with the infectious agents. What kinds of infections are we talking about that can trigger uveitis?
There's quite a wide range, actually. Fungal infections are definitely on the list, things like blastomyces, cryptococcus, coccidioids, histoplasma, often depending on geographic location, like we mentioned.
Right, the regional fungi.
Yeah. Then there are protozoal infections like Toxoplasma and Neospora. We also see rickettsial infections, which are often tick-borne Ehrlichia and rickettsia, the cause of Rocky Mountain spotted fever.
Okay.
Various bacteria can also be culprits, Leptospira, Bartonella, Brucella, Borrelia, which causes Lyme disease. And really, any generalized bacterial infection that gets into the bloodstream, septicemia, could potentially seed infection in the eye.
So bacteria too. Wow.
Less commonly, we can even see algae, like prototheca,
Right.
viruses too, adenovirus, which can cause kennel cough, distemper virus, rabies, herpes virus, and even certain parasites, like types of worms migrating through the eye.
That is a significant list of potential invaders.
Okay, so if it's not an infection, what are some of the immune-mediated causes, where the body attacks itself?
Right. Immune-mediated uveitis happens when the dog's own immune system kind of mistakenly targets the tissues inside the eye. This can occur, for instance, as a reaction to the proteins inside the lens, maybe after the lens is damaged by trauma, or during cataract development or after surgery.
Oh, okay.
Uveodermatologic syndrome, which we talked about earlier with breeds like Huskies and Akitas, that's another really important immune-mediated cause.
Right, the eye and skin one.
Yes. And in rarer cases, you might see a reaction following a canine adenovirus vaccination or as part of a systemic vasculitis, which is basically inflammation of blood vessels throughout the body that happens to affect the eye, too.
Okay. And what about neoplastic causes? We're talking about cancer here, aren't we?
Yes, unfortunately.
Yeah?
Primary tumors that actually start within the eye itself, things like uveal melanoma or iridociliary adenoma or adenocarcinoma, they can cause inflammation.
Right, makes sense. But also, maybe even more commonly, cancer from another part of the body can spread to the eye. That's metastasis. And that metastatic tumor in the eye can trigger uveitis. Lymphosarcoma, or lymphoma, is probably the most common type of cancer to spread to the uveal tract, the part of the eye affected in uveitis.
That's definitely a serious consideration.
Yeah.
What about metabolic causes? How can things like that impact the eye?
Well, certain metabolic conditions can sort of create an environment within the body and subsequently the eye that makes it more prone to inflammation. These include things like hyperlipidemia, which is high levels of fat, like cholesterol or triglycerides in the blood.
Okay.
Also, hyperviscosity syndrome, where the blood becomes abnormally thick, maybe due to high protein levels from certain cancers. And systemic hypertension, just plain old high blood pressure, can also contribute to or cause uveitis.
Okay, so conditions we might associate more with overall health can definitely spill over into the eyes. And then there's that miscellaneous category. What kind of things fall into that bucket?
Yeah, this is sort of a catch-all for causes that don't fit neatly into the other groups. Probably the biggest one here is idiopathic uveitis.
Meaning you just don't know the cause.
Exactly. Despite a thorough workup, sometimes we just can't pinpoint the specific underlying trigger. Trauma to the eye, like a poke or hit, is another obvious cause.
Sure.
That pigmentary uveitis, specifically in golden retrievers, falls here. Also, conditions originating nearby, like severe ulcerative keratitis ulcers on the cornea or corneal stromal abscesses,
Yeah.
even scleritis, which is inflammation of the white part of the eye, the sclera,
Okay.
lens instability or luxation, where the lens is wobbly or moves out of place, can certainly cause inflammation. And interestingly, even severe dental or periodontal disease in some cases.
Really, dental disease, how does that connect?
The thinking there is that bacteria from the severe gum disease can get into the bloodstream, a bacteremia, and then potentially lodge in the eye, triggering inflammation. It's an indirect link, but it's considered a possibility. And finally, toxemia, just the presence of toxins circulating in the blood from various sources, can sometimes manifest as uveitis.
Dental disease leading to eye problems, it's fascinating, something many owners might not connect at all. Okay, so with all these potential causes, how does a veterinarian actually go about diagnosing anterior uveitis and then trying to figure out what the root issue is? It sounds complex.
It really starts with that thorough physical and ophthalmic examination we talked about earlier. It's so important to assess the dog's overall health, not just the eyes. Then we start thinking about a list of differential diagnoses, basically, other conditions that could look similar.
What are some of those conditions that might mimic uveitis but actually aren't?
Well, for example, simple conjunctivitis can cause a red eye, right? But usually the redness is more superficial. The discharge might be different, maybe thicker. And the discomfort often lessens quite a bit if you put a drop of topical anesthetic in the eye, which wouldn't really help true uveitis pain.
Okay.
Glaucoma is a huge one to rule out. That involves increased pressure inside the eye, often causing redness and cloudiness too, but the pupil might be dilated instead of constricted. Measuring the pressure is key there.
Right, crucial difference.
Lens luxation, especially in certain breeds like terriers, can cause inflammation and cloudiness. Ulcerative keratitis, a scratch or ulcer on the cornea, will cause pain, redness, and localized cloudiness, but it should stain positive with fluorescein dye.
Ah, the dye test.
Exactly. Then there are conditions like corneal endothelial dystrophy or degeneration, which cause diffuse corneal edema, that cloudiness, but usually without the redness, pain, or low pressure of uveitis. And even something like Horner's syndrome needs to be considered. It causes a constricted pupil, and the third eyelid might be up, but it's typically not painful, there's no discharge, and other specific signs are different.
So it's really about carefully looking for those subtle differences, measuring pressure, maybe staining the eye, and considering the whole clinical picture.
Precisely.
And what role do lab tests play in diagnosing uveitis and maybe finding that underlying cause? Are blood tests usually helpful?
Basic lab work like a complete blood count, CBC, a biochemistry profile, and a urinalysis are often performed as a starting point. Now, these might be completely normal if the uveitis is truly just isolated to the eye or idiopathic,
Okay.
but they can definitely reveal abnormalities that point towards an underlying systemic disease, things like signs of infection, inflammation elsewhere, kidney or liver issues, or changes suggestive of certain cancers.
And if you do suspect a systemic infection, based on other signs maybe, what kinds of specific tests might be run then?
Yeah, if there's suspicion of an underlying infectious cause, maybe the dog also has a fever, is lethargic, has enlarged lymph nodes, is coughing, things like that, then serology can be really helpful. That's testing the blood for antibodies against specific infectious agents.
Like the fungal or tick-borne diseases?
Exactly. The choice of which specific tests to run for blasto or Ehrlichia or Lyme, etc., will really depend heavily on what the vet suspects based on all the other clinical signs and, importantly, the dog's geographic history and travel history.
Makes sense. What about imaging, like X-rays or ultrasound? When might those come into play?
Chest x-rays or thoracic radiographs can be very useful. They can help identify signs of systemic fungal infections, which often affect the lungs, or look for evidence of cancer having spread to the lungs, metastasis.
Okay.
Abdominal ultrasound might be recommended if there's a suspicion of cancer spreading to the abdominal organs, like the liver or spleen, or if we suspect something like leptospirosis affecting the kidneys.
Right.
And if the veterinarian can't get a good view inside the eye because the cornea is too cloudy or there's blood or pus in the front chamber, then ocular ultrasound becomes invaluable. It allows us to visualize the structures inside the eye, check for things like tumors within the eye, or see if the retina has become detached.
So ultrasound for the eye itself sometimes. Are there any specific diagnostic procedures that might involve actually taking samples from the eye?
Well, the most crucial diagnostic procedure is measuring the pressure inside the eye tonometry. As we said, low pressure often points towards uveitis, while high pressure suggests glaucoma, so it's fundamental.
Tonometry, got it.
If lymph nodes are enlarged, taking a small sample with a needle, a fine needle aspirate, can be very useful to look for signs of infection or cancer cells under the microscope. In some very specific situations, particularly if a retinal detachment is seen on ultrasound and an infectious cause is suspected back there, a specialist might consider taking a sample of fluid from behind the retina, a subretinal aspirate. But generally speaking, taking fluid from the front chamber of the eye, the anterior chamber, is usually not very rewarding for pinpointing the cause of the uveitis. The inflammation tends to be pretty nonspecific there.
Okay, so usually not tapping the front of the eye. And finally, if, say, a definitive diagnosis isn't reached while the dog is alive, or maybe if an eye has to be removed, what might a closer look at the actual eye tissue reveal later on?
Right. Examining the eye tissue itself under a microscope that's histopathology can provide really important clues even after the fact. Grossly, you might see the corneal edema, the blood vessel growth, those keratotic precipitates, maybe adhesions forming. And then microscopically, the pathologist would look for the specific types and patterns of inflammatory cells infiltrating the iris, the ciliary body, maybe the sclera or the choroid in the back. They could confirm changes like a secondary cataract forming. And in cases where the back of the eye, the posterior segment, was also involved, they might see evidence of membranes forming in the vitreous, traction bands pulling on the retina, and definitive retinal detachment.
Okay, so once anterior uveitis is diagnosed, what are the typical treatment approaches? Is this usually something that can be managed at home by the owner?
Yes, in most cases, anterior uveitis is managed with outpatient medical treatment. So the dog goes home with medications. Usually there aren't specific changes needed in the dog's routine nursing care or diet, although providing a somewhat quiet, dimly lit space can certainly help make them more comfortable if they're showing that photophobia, the light sensitivity.
Right, just make them comfy.
Yeah.
And what's the dog owner's role in this whole treatment process? What are the really key things they need to understand and do?
Oh, client education is absolutely crucial here. We really need to emphasize that possibility of an underlying systemic disease and why pursuing those diagnostic tests to try and identify it is so important.
Yeah.
Owners need to understand that while we will definitely be treating the inflammation in the eye, addressing any underlying cause we find is absolutely essential for the best long-term outcome. They also really need to be informed about the potential complications we discussed, like glaucoma or cataracts, and the vital importance of sticking to the treatment plan exactly as prescribed. That means giving all the medications on time, every time, and definitely attending all the scheduled follow-up appointments. Compliance is key.
Yeah, that owner part is so key, isn't it?
Absolutely.
Are there ever situations where surgery might become part of the treatment plan for uveitis?
Surgery isn't typically the primary treatment for the uveitis itself. However, it might become necessary in certain situations. For instance, if the lens has actually ruptured due to trauma, it might need to be surgically removed. Or, if cataracts develop because of the uveitis and are significantly contributing to ongoing inflammation or vision loss, cataract surgery might be considered, but only if the underlying inflammation is well controlled and the overall prognosis for vision after surgery is thought to be reasonably good.
Right.
And of course, if secondary glaucoma develops and can't be controlled with medications, then various surgical procedures might be needed to try and manage that high pressure.
So medication is usually the main tool in the toolbox for treating the actual uveitis.
Yeah.
What are the go-to drugs that veterinarians typically reach for?
Corticosteroids are generally the most effective medications, really the drug of choice, for controlling the inflammation associated with anterior uveitis.
The steroids, okay.
They are most commonly administered topically as eye drops or ointment. The most effective topical choices are typically prednisolone acetate, usually at a 1% concentration, and dexamethasone, usually 0.1%.
Prednisolone and dexamethasone.
Yes. The frequency of application, how many times a day they need to be given, will depend entirely on how severe the inflammation is initially. It might be quite frequent at first, maybe every 4 to 6 hours.
Okay.
And then it's incredibly important to gradually reduce the frequency of application. We call that tapering the medication as the eye improves. You can't just stop them abruptly, or the inflammation is likely to flare right back up.
Right, got to taper off slowly.
Exactly. And one quick note, other types of topical corticosteroids, like hydrocortisone or even plain dexamethasone sodium phosphate, are generally much less effective at penetrating into the eye to treat uveitis compared to prednisolone acetate or dexamethasone alcohol.
Good to know.
In more severe cases, a veterinarian might also choose to give a one-time injection of a longer-acting corticosteroid, like triamcinolone acetonide or methylprednisolone, right under the conjunctiva, that surface tissue around the eyeball. This can provide a depot of medication, but it's usually done alongside starting the topical drops, not instead of them.
Okay. What about using oral or injectable corticosteroids, like pills? When might those be considered?
Systemic corticosteroids, like prednisone given by mouth, might be used in some cases, especially if the uveitis is very severe or if both eyes are affected or if there's evidence of inflammation elsewhere in the body, too.
Mm-hmm.
However, we generally only use them after we've reasonably ruled out any underlying systemic infections because steroids suppress the immune system and could potentially make an infection worse.
Ah, right. Caution there.
Yes. And if systemic corticosteroids are used, just like the topical ones, the dosage is typically reduced gradually, tapered, usually after maybe 7 to 10 days of initial treatment, depending on the response.
Okay. Are there other types of anti-inflammatory medications besides steroids that might be used? NSAIDs, maybe?
Yes, non-steroidal anti-inflammatory drugs, or NSAIDs, can also help to reduce inflammation and provide some pain relief. However, when given topically as eye drops, they are generally considered less potent, less effective than corticosteroids for controlling the internal eye inflammation of uveitis. Less effective topically.
Okay.
Examples of topical NSAA eye drops that might sometimes be used, often in conjunction with steroids, include flurbiprofen and diclofenac,
Right.
systemic NSAIDs, the oral pills or liquids like carprofen, topoxylin, meloxicam, firocoxib can also be used to help with overall inflammation and pain control. But, and this is important, we have to be very careful not to use systemic NSAIDs at the same time as systemic corticosteroids.
Ah, no double dipping with systemic anti-inflammatories.
Exactly. The risk of side effects, particularly gastrointestinal problems like ulcers, goes way up if you combine them. Also, systemic NSAIDs are generally avoided in cases where there is significant bleeding in the front of the eye, that hyphema we mentioned, as they can potentially interfere with clotting.
Okay, good precautions. And I noticed mydriatis cycloplegic medications on the list earlier. That sounds complicated. What do those do to help with uveitis?
Yeah, it sounds fancy, but they're really important. These medications, and the main one we use is atropine sulfate, usually as a 1% eye drop or ointment, have two key benefits in uveitis.
Okay, what are they?
First, they dilate the pupil. That's the mydriatic part. A constricted pupil, which is common in uveitis, can be uncomfortable due to spasm of the iris muscle. Dilating it helps relieve that pain.
Makes sense.
Second, and maybe even more importantly, they relax the muscles in the ciliary body, that's the cycloplegic part. This not only further reduces pain, but crucially, it helps to prevent the back of the iris from sticking to the lens behind it, preventing those posterior synechia we talked about, which can lead to serious complications like glaucoma.
So keeping the pupil wide helps prevent stickiness.
Exactly. It keeps things moving, so to speak.
Mm-hmm.
Again, the frequency of applying atropine is adjusted based on achieving and maintaining pupil dilation and keeping the dog comfortable, and then it's also tapered off slowly as the uveitis resolves. We don't want to keep the pupil dilated forever.
Right. Are there any medications that should definitely be avoided or used with extreme caution in cases of anterior uveitis?
Yes, absolutely. We definitely want to avoid using miotic medications, drugs that intentionally constrict the pupil, like pilocarpine, which is sometimes used for glaucoma, as that would be counterproductive and likely painful in uveitis. Also, topical prostaglandin analogs, another class of glaucoma drugs, can actually worsen inflammation, so they're contraindicated in active uveitis.
Okay. No pupil constrictors or prostaglandins.
Correct. And a huge one. Topical and subconjunctival corticosteroids should never be used if there is any suspicion or confirmation of a corneal ulcer, that ulcerative keratitis. Steroids can severely impair corneal healing and potentially make an ulcer much, much worse, even leading to rupture.
Very important point. No steroids if there's an ulcer.
Critical. And as we touched on, systemic corticosteroids should generally be avoided or used with extreme caution in dogs known to have systemic hypertension, or if an active systemic infection is suspected or confirmed and not yet being treated appropriately.
Got it. What about any potential side effects or drug interactions beyond the steroid NSAID combo that owners should be watching for?
Well, with the topical atropine, while it's very beneficial, we need to use it judiciously, and the vet needs to monitor the eye pressure periodically. In some susceptible dogs, paralyzing the ciliary muscle and dilating the pupil can occasionally interfere with fluid drainage and actually increase the risk of developing secondary glaucoma. It's not common, but it's something to watch for.
Okay, so monitor pressure even with atropine.
Yes. And otherwise, the main interaction to remember is avoiding concurrent systemic corticosteroids and systemic NSAIDs due to that increased risk of GI side effects.
Okay, so careful monitoring by the vet and really strict adherence to the medication instructions by the owner are absolutely key then.
You couldn't emphasize it more.
What does the typical follow-up care involve after starting treatment?
A recheck examination is usually scheduled pretty soon after starting treatment, typically within 3 to 7 days, really depending on how severe the uveitis was initially.
Okay, pretty quick follow-up.
Yeah. And at this first recheck, besides assessing how the inflammation is responding to treatment, checking that intraocular pressure again is critical to monitor for any early signs of secondary glaucoma developing.
Right, catch that early if it happens.
Exactly. Subsequent recheck appointments will then depend entirely on how well the dog is responding to the treatment and the veterinarian's clinical judgment.
Hmm.
It might be weekly for a bit, then every few weeks, then maybe months, depending on the case, and if an underlying cause was found and treated.
And what are some of the potential complications that can still arise, unfortunately, even with appropriate treatment?
Well, as we discussed earlier when talking about chronic changes, several significant ophthalmic complications can still occur even if treatment is initiated. These remain the development of secondary cataracts, secondary glaucoma, lens luxation, retinal detachment, and potentially, if the inflammation just can't be controlled or causes too much damage, the eye shrinking and becoming non-functional, that's dices bulbi.
So those long-term risks are still there?
They are, unfortunately. And additionally, it's crucial to remember that if the uveitis is just a sign of an underlying systemic disease, like a fungal infection or cancer, there can obviously be serious complications related to that primary condition, which in some cases can be life-limiting, quite apart from the eye itself.
Yeah, that really puts the eye issue in perspective sometimes. So the overall outlook, the prognosis for a dog with anterior uveitis can really vary quite a bit then.
Exactly. The expected course of the disease and the ultimate long-term prognosis are highly, highly variable. It depends so significantly on whether we can identify and successfully treat the underlying cause of the uveitis, if there is one, and also just how well the individual dog's eye responds to the anti-inflammatory treatment itself. Early diagnosis and aggressively addressing the root cause, if possible, are absolutely crucial for achieving the best possible outcome, both for the eye and the dog's overall health.
Well, this has been an incredibly thorough deep dive into anterior uveitis in dogs.
Yeah.
Just to maybe quickly recap the key takeaways for everyone listening. It's clearly a complex condition affecting the front of the eye. It has a really wide array of potential underlying causes, which makes that comprehensive veterinary examination absolutely essential.
Mm-hmm.
Recognizing those early warning signs, the red, the cloudy, the painful eye, and understanding that it might actually be connected to a more widespread systemic issue are just vital for effective management and hopefully getting a positive outcome for our beloved canine companions.
Absolutely. Hopefully, you listening now have much more in-depth understanding of anterior uveitis, really going beyond just recognizing the symptoms to grasping the underlying mechanisms, the kind of diagnostic process your vet will likely follow, and the sheer multitude of potential reasons why it might be happening in the first place.
And that kind of leaves us with this thought to ponder. Given that sheer number, that diversity of potential underlying causes for anterior uveitis, what new questions might this information spark for you about the really intricate ways a dog's overall health is connected, often surprisingly connected, to the health of their eyes?
Yeah.
And maybe what might be your next step in being proactive about your own dog's well-being, whether that's just paying closer attention to subtle changes or perhaps even exploring a bit more information about conditions that might be more common in your particular dog's breed or prevalent in your area. Something to think about.